We will get to those stories in just a minute, but first this hour, the latest development in a big year of change for one of the state's northernmost healthcare facilities. In January, nurses at Northern Maine Medical Center voted to unionize. Then a month later, emergency room nurse Tiffany Daigle said she was fired. Daigle says she was not allowed to work per diem after her contract was up. The hospital says her contract ran out. The union fought for months on her behalf, and just last week, she was offered her job back. Last month, NMMC closed its 7-bed child psychiatric unit. The closest facility providing that care is in Bangor, about 3 hours away. All of the nurses in that unit were transferred to other parts of the hospital and say they were blindsided by that move. Now, the hospital nurses are filing a charge of unfair labor practices against the hospital, saying union contract negotiations have taken too long. News Center Maine's Katie Delaney has more.
Northern Maine Medical Center nurses behind me here are picketing, calling on management to bargain in good faith. NMMC nurses voted to join the Maine State Nurses Association back in January. They started negotiating a union contract with hospital management in April and have met 12 times since.
This pace is unacceptable.
Nurses taking a stand.
Orkin is a union town.
Pushing for contract negotiations to be in person and more often. With the contract, nurses want to be protected and have a voice.
I really hope that once we can get our union contract achieved, that we'll be able to improve our staffing ratios here and to provide better care to our community.
The hospital says it is bargaining in good faith. In a statement, an NMMC spokesperson says, "Our nurses are very important to us and are an integral part of our success and the quality care we provide to our patients. We respect our nurses and will continue to bargain in good faith." The picket also comes after the hospital's child psychiatric unit was closed last month. Nurses who worked in the unit say they were blindsided.
Shock, disappointment, anger.
Terry Karen worked in the child psychiatric unit for more than a decade, and she's seen how much of an impact it's had.
To just shut down another unit is just a loss.
The hospital said in a statement it shut down the unit to become a critical access hospital for a more sustainable future. They say designation would allow for increased federal reimbursements.
Getting the best contract we can for the patients that we that we have left, so it doesn't happen to another one of our units.
Once the union files the unfair labor practices charge Thursday, the National Labor Relations Board will investigate and decide whether to issue a complaint against the hospital. In Fort Kent, Katie Delaney, News Center, Maine.